We talk about this and we complain, AJ. So tell us, what are some of the fixes?
I think if we just boil it down for simplicity's sake, direct primary care is a great foundation to build upon. If you stretch that out across different populations, and I personally think the Medicaid population is ripe to find these primary care physicians, pay them X per member per month, whatever that might be, to manage these patients, people are going to be healthier overall. So I think that's a big facet of it. Direct specialty care, which is pretty new. Starting to see people pop up all across the place now. People like Dr. Wallen, which I know you've interviewed him. He's a great person. But these types of things where we pay directly, and whether that's the employer paying directly or it's the patient paying directly, these are the types of arrangements that are going to move the needle. Paying cash for things is proven to be a lot cheaper. But then again, how do we get over this psychological barrier in this country that we need health insurance to get healthcare or to get any type of service? It's not true. And that's kind of been ingrained in the skulls of every American, and the Affordable Care Act kind of just exacerbated that. So I think if you start to think of, well, I need insurance because what happens if I'm I'm in the emergency room with a trauma or I get cancer? These are big issues that you have to consider. But paying $10,000, $15,000 a year before your insurance kicks in is not the right. It's not sustainable, obviously, and it's only going to get worse unless people start to wake up and get out of that. So you've got different cost sharing groups like Crowd Health and Sedera, and I think more of those will pop up, and you'll start to see kind of then your full health coverage plan gets kind of designed like that.
Yeah, for sure. And I think one thing we need to remember, like Dr. Marion Moss says, is that coverage doesn't equal care. So, people are covered under all these insurances. Let's use Medicaid as an example. You use Medicaid, which Medicaid people pay zero copays. They have zero deductible. In theory, they cost them nothing, at least indirectly. But I know direct primary care doctors, they take care of a lot of Medicaid patients. These Medicaid patients will pay them $50, $70 a month because they have this Medicaid coverage, but they can't get in to see their doctor for 6 months. So they pay to see a doctor cash. That's kind of the system that we've got. Coverage does not equal care.
Yeah, it's 100% true. And, a lot of the time on Twitter, I have to stop people. And even in real life, they start talking about healthcare. And I go, hold on, you're talking about health insurance. We're not talking about the delivery of care. You're talking about how to access that, which is proven to be illogical.
Well, I also think, too, we have this misconception that if we have insurance, it's going to save you from bankruptcy. And if you look at the statistics, that's not true at all, that most of the people that have filed bankruptcy because of a healthcare problem or a bill, it's people that have coverage, and that coverage was poor or it didn't cover what needed to be done. And so when you look at the DPC model and the sharing ministries or the sharing groups that are out there, you don't see that type of thing happening. So we have this false hope that that insurance is saving me from a hardship financially, which isn't happening.